Good evening, my name is Megan Lewis, and I'm going to tell you my prediction for my subjects that I saw. So, my subject 1 was located in Panera Bread, and my subject 2 is located in the IUPUI Campus Center. So, basically, how I defined being somebody who's sick is somebody who obviously has like fluids coming out of their mouth or nose or secretions. So, if they're coughing, sneezing, or like stuff coming out of them, then they are sick. I also define it as like somebody who have a lot of tubes coming out of their body or they're just looking like deathly ill. And I also define it as more of a temporary thing. It's not something that's going to be like permanent because I think sickness is more of a subjective thing that's just temporary, and then it's either going to evolve and get better or it's going to evolve and get worse and become an illness or disease. So, like, my biggest prediction for my subjects that I did was that both of them are going to be healthy and they're not sick at all. So, starting with subject 1, like I said, he was in Panera Bread. To give you a picture of him, he walked by my table to leave, but he was sitting at a table nearby me, and he was sitting with his family. He looked like he was in the mid 50s. He may have been 60, but he looked mid 50s. He was communicating and talking to his family. He was eating lunch there with his family and his wife. He had some kids. Um, he was a Caucasian male with darker skin tone. He did not have any like lesions or anything wrong with his skin. The skin was like a natural pink color. There didn't seem to be any tattoos or anything that he had recently gotten or anything that would mess up his skin. He didn't have any like cuts or bruises or anything on his skin. So he looked pretty clean in that. Regarding his hygiene, he looked pretty clean. There was no odor detected when he walked by me. As for his hair, he did have a circular patch of hair missing in the back of his head, so that was abnormal. It looked like it was thinning. And then as for my analysis, I felt like that is a normal part of aging based on what the book had said, because the book had saying like thinning of hair and losing part of your hair, especially for men. It tends to happen more in men, but that is a natural part of the middle age. And his hair was also turning gray as well. And as far as his facial features, he did have blue eyes. He did have hair coming out of his ears a little bit, but nothing like major, just a little bit I saw. He had natural pink lips. There was no blue or cyanosis around his lips. So he looked like he had good oxygen concentration. Um, he did have a really, really dark yellow appearance on his teeth. So I marked that as abnormal because most people have um, either like they consider normal teeth to be like straight. There's no like malocclusions or anything like that. And he didn't have any problems eating, um, but he did have like really, really rough stains and like a lot of stuff in his teeth. So that seemed really abnormal, and it seemed like he hadn't been cleaning his teeth in a while. He, I did not put him as being sick in this category for the physical appearance and hygiene, just because he didn't appear sick. He didn't have any of the symptoms that I already said, like he didn't have any coughing, sneezing, or anything like that. He didn't have tubes hanging down from him. He appeared healthy and he was generally happy. So I didn't put that for that one. For the body structure and position, like I said, he was sitting down eating his food, so he was sitting pretty slumped forward to like eat the soup and stuff that he was eating. When he was sitting forward, I did notice that his rib cage was a bit profound on the right side. Um, as being a person who has scoliosis, I recognize the signs of it. So that is an abnormal finding of mine that He has an abnormal symmetry of the right posterior rib cage. And so I said that was abnormal and unexpected, but I did not classify him as being sick in this category because the book was saying that just because you have these abnormal findings, he wasn't classified as sick because um, what's it called? That it wasn't like super impacting his body. It looked like I could tell he had scoliosis, but it didn't look like it was affecting him to like a huge deal. And I also couldn't measure like the length of limbs and stuff to get a better grasp of that, of how serious it is. But I felt like he was pretty healthy based on what the book was saying. As far as his body movement, everything checked out here. He was able to have full function of all the extremities. He had like normal rhythms and swings of his arm and symmetry. It looked like, from my vantage point, I didn't go measure him, but it looked like he was normal. And he seemed to have a normal walking gait when he was walking out of the place. I could not access the climbing or the crawling ability of the patient, but he looked like he could do it if I were to go ask him, but I don't know that for sure. I put that the patient was healthy in this category because he was not limping. He didn't have a hard time walking. He wasn't using any assistive devices or anything like that to help aid that. So I said he was healthy based on what the book was talking about with any of those abnormal findings. I didn't find any. And then for the emotional and mental status of subject one, he was alert and focused on his family, so he didn't have any problems there. He was smiling. He had a good tone of voice. He had a good affect. He had good eye contact with his family. He had a sense of communication. So I did not have any abnormalities regarding this. Um, as far as the behavior and the body language goes, he seemed to have a pretty good body language. He wasn't like going crazy or anything. He seemed like he was a pretty inviting guy. If I were to go talk to him, I didn't, but he seemed like he was a good guy to go and communicate with. I said he was healthy in this category as well. There did not seem to be any abnormalities regarding this. So I would say overall that this patient for subject one was healthy. I did not classify him as sick. So I think my prediction and my evidence backs it up that the patient was not sick. However, I do believe that the patient may have been sick, but I can't tell from an observation standpoint. So he could have some underlying like issues health wise, but I can't tell that just by looking at it. I'd have to do more investigation. But from my vantage point, he looked healthy and he looked happy. As far as subject number two, this person was in the IUPUI Campus Center. He looked to be in the early 20s. He was a young college guy. He had an IUPUI sweatshirt on, so he definitely went to IUPUI. He was carrying a book bag and he did not have any skin lesions or like any variations in the skin tone. He appeared he was clean. He did have he looked like he was very strong muscular guy, so he obviously like works out and like takes care of himself. He did not have any abnormalities with his hair color or distribution. It was all well maintained. It was put in a man bun. As far as facial features, he had the blue eyes, normal color, pink tone. He did have straight white teeth, so there was no abnormalities there. So everything checked out in the physical appearance and hygiene category. He was healthy in all those categories. There was no abnormalities. As far as the body structure and position, so this person was sitting pretty erect with a good posture when he was eating. He was not slouching. He had his shoulders back and he was eating. He seemed to be well nourished. He obviously takes care of his body. He was very, very muscular and like looked pretty built up. He looked like he had good body proportions. I couldn't measure him to determine like if he was symmetrical in all the areas, but he looked like it from my vantage point. I marked him as healthy in the analysis based on the book and the abnormalities the book had mentioned. The patient did not have any, so he was marked healthy in that category. As far as body movement, the patient looked like he was able to move around. He was moving around quite a lot when he was sitting there talking to his friends, like going toward them, backing up and stuff. He looked like he had pretty good range of motion. There was no like unequal lengths of extremities that I could tell from my vantage point. Of course, I didn't measure him, but he looked like he had a good symmetry. His gait was fine. He did not have any limps or anything like that. Patient was walking. I could not access the climbing or the crawling, but the patient looked very fit, so he probably does that on the regular anyway for his training purposes. There was no limitations of movement from what I could tell. He was sitting there and then he got up to leave, but he didn't seem to have any limitations. As far as analysis go and based on the book, I said he was healthy. There was no reason to think why he would not be healthy in this category. He had a smooth gait and he appeared healthy. There was no abnormal extremities, and he had a really healthy physique. As far as emotional mental status, he seemed very alert. He was very focused on that conversation he was having with his friends. His facial expressions matched the conversation that I was hearing, and his tone of voice definitely matched what they were talking about. He had a good affect, and he was maintaining eye contact with his friends. As far as analysis from the book, I believe this patient is considered healthy. The patient did not have like any anxiety or lack of energy. He was actually very full of energy and um, did not show any case of anxiety. He seemed very lively for the early morning that I was there. As far as the behavior of the person, he seemed very warm and inviting. He actually had a couple friends show up to the table, so he seemed to invite them. His body language was appropriate. As far as his analysis goes on this category, I said he was healthy. All the behaviors and stuff was expected. He seemed like the volume was not too loud for him, or his volume, I should say, was not too loud. He seemed to be pretty healthy in this category. He didn't have any like negative body language or anything like that, so I deemed him healthy in that category. As far as the patient for subject 2 and subject 1, I deemed them both to be healthy. I do not believe any of them are sick. But like I said with subject 1, subject 2 could have underlying diseases that I don't know about. But it's very hard when you're just observing someone. You can't really tell if they are sick. Um, you have to like go and examine them and like get a full history and like to really know what they're dealing with in the inside, because people can really hide it and it may not even be like a known disease, or you can see it. um so that's that. And so what I've learned about the significance of the inspection process, basically the biggest thing with the inspection process that I've learned is you can't judge a book by its cover. You have to go and examine them, touch them, palpate them, like feel and like really get to know like their history, all the different things that they've done in their past, environmental stuff. Like you really need to get in depth with them. You can't just look at somebody and assume something. You have to really dig in there. And then things that I can improve my inspection skills, I think to be just more observant. Like there were certain things that was on there. I was like, oh, I didn't really think about that being like something I should be like considering. Like I didn't think about body language. I was thinking more of like oh, like they're just sitting there. Like I didn't think about like being negative or positive body language towards someone. Like I just never thought about that. So that's something I can really improve on and focus and hone on my skills for the inspection process. And I think that's it. Thank you.